Hello, everyone. My name is Simone Merkerson, and today I am going to be talking about a problem that impacts thousands of military families, one that goes beyond access to resources and speaks directly to how those services are structured and delivered. This quote sets the tone for today's discussion. The challenges facing military families are not due to lack of resources, but how those resources are structured. To truly make an impact, we must rethink how systems are designed to work together. Just imagine serving your country while fighting a battle at home that no one sees. You're a parent of a military child that has special needs. You receive orders to relocate, and immediately everything changes overnight. Your child loses access to their therapist. Their school doesn't support transfers smoothly. You're placed on a waiting list in a new city where you don't know anyone. You're calling providers, calling schools, TRICARE explaining what your child needs are over and over again, just trying to get back to where you are. Meanwhile, your child is struggling. Progress you've worked on and so long and hard for are beginning to slip. And while you're trying to hold everything together at home, you're still expected to fully show up for your mission. I want you to pause for a moment. Do you know someone who has gone through this? Or maybe you've experienced something similar yourself, because many military families raise children with disabilities. This isn't rare, this is just their reality. And the hardest part is not that support doesn't exist. That support, it does, but it's not connected. Families are left to navigate healthcare, education, community systems that operate independently, forcing them to carry huge emotional, financial burdens on their own. This is not just a family issue. It impacts the child's development, caregiver well being, and ultimately mission readiness. Then the question then becomes, why are these systems designed to actually work together? Approximately 10% of military connected children have special needs impacting thousands of families. Families often spend weeks coordinating services across providers, which leads to delay in care and a heightened financial burden. Caregivers experience burnout, and children may face interruptions in critical services. At a system level, this creates inefficiencies and reduces the effectiveness of the programs that already exist. There are several key drivers behind this problem. First, system operates independently with little or no coordination. Healthcare, education, military, and community organizations all have their own process, but they're not designed to work together. Second, military relocation disrupt continuity of care. With each move, families are forced to rebuild their support structure from the ground up. Third, communication gaps limit information sharing, not because people don't want to share, but these systems simply are not connected effectively. There's no one shared system, no standard way to transfer information, no single entity that is responsible for ensuring that care continues. Instead of systems working together, families are left to carry the gap, repeating records, coordinating their own care. And at the core, what's missing is a central coordination point, a single place where families can enter the system and be guided from start to finish. Because of that, awareness of resources is inconsistent and access often depends on who knows who rather than what you need. Together, these factors create a system that is difficult to navigate, inconsistent delivery, and ultimately inequitable. Because the problem is both access and coordination, the solution must address both. And that is what drives the design for this model. The solution is a hybrid model designed to improve both access and coordination. This approach is grounded in both research and real world experience, which shows that solutions combining technology, partnership, and human support are more effective than any one approach alone. First, a centralized digital platform serves as a single access point, allowing families to input their needs once and receive personalized connection to resources. Second, strategic partnerships across military organizations, healthcare providers, educational systems, and community based organizations ensure that services are aligned and not operating in isolation. Third, workshops delivered both in person and virtually provide families with the knowledge and support needed to navigate the system effectively and build trust. The model is delivered through both digital and in person channels, ensuring accessibility while also strengthening engagement. Together, these components address not just access to resources, but how those resources work together to support our military families. This solution creates value on multiple levels. For families, it simplifies access to resources and reduces the stress of having to navigate multiple systems. For organization, it improves coordination and reduces duplication of efforts. For stakeholders, it provides a scalable model with measurable impact. But to bring this from concept to reality, we begin with a minimum viable product. The MVP is a pilot program launched in a defined market like Hampton Roads. This includes a basic digital platform with an intake tool, a resource directory, and a small group of strategic partners, and a monthly workshop delivered both in person and virtually. This allows us to test engagement, evaluate coordination across services, and identify opportunities for improvement before scaling. So, this is not just a social solution, it's an operational model that can be tested, refined, and scaled. Execution focuses on how we implement and measure success. Execution begins with launching the pilot in Hampton Roads, where we activate partnerships and begin delivering services through both digital and in person channels. Workshops delivered both in person and virtually serve as the primary entry point to engage families and to ensure that they're connected to the platform. From there, measurement is built into every step. We assess success by comparing outcomes before and after each engagement. This includes reduction in time to access services, the number of successful referrals, the increased awareness of available resources, and overall engagement across the platform and workshops. This model is supported by key resources, including technological infrastructure, trained personnel such as financial counselors, and case managers, strategic partnerships, and funding. Together, this ensures that the solution is not only implemented, but it ensures that it will remain continuous and improved and scaled based on real results. And finally, military families should not have to navigate these fragmented systems alone. By transforming how the system works together, we can reduce the burden on families, improving outcomes for children, and build a stronger and more coordinated support system. But this does not happen without action. So, my ask is very clear for organizations, partner to help align services and eliminate these gaps between systems. For leaders, support pilot implementation and invest in the solutions that are measurable and scalable. And last but not least, for our communities, help us identify and reach those families who need the support the most. Because the families are already doing the work, connecting broken systems, and they should not have to do that. We have the resources, we have the expertise. Now we need the alignment. This is not just a concept, it is a path. This is a path forward to a real and measurable impact. In the words of W. Edwards Deming, systems are perfectly designed to get the results they produce. And right now, the results we're seeing are delay, fragmentation, and overwhelmed families. These are not accidental. They are a result of the systems that were never designed to work together. So, if we want a different outcome, we have to ensure that they're designed differently. Not just by adding more programs, but by connecting the ones that already exist. Because when systems work together, families don't have to fight for support. That support shows up for them. Thank you.